Hello and welcome. Let's start answering questions that might come at Prometric exam for pharmacy. A patient presents with symptoms of severe anxiety and is prescribed diazepam. What is the primary pharmacological action of diazepam? A. Antidepressant. B. Anxiolytic. C. Antipsychotic. D. Stimulant. The right answer will be B. Anxiolytic. Diazepam is a benzodiazepine primarily used as an anxiolytic to relieve anxiety symptoms through its sedative effect on the central nervous system. Next, which of the following medications is contraindicated in pregnancy due to its teratogenic effects? A. Acetaminophen. B. Warfarin. C. Insulin. D. Metformin. The right answer will be B. Warfarin, which is contraindicated in pregnancy because it can cause fatal bleeding and malformation. Alternative anticoagulants like heparin are often used instead. Next, what is the most common side effect associated with the use of opioid analgesics? A. Nausea. B. Drowsiness. C. Respiratory depression. D. Constipation. The right answer will be D. Constipation is the most common side effect of opioid use due to its drug action on the GIT, gastrointestinal tract, leading to decreased motility. Next, a patient with a history of peptic ulcer disease is prescribed NSAIDs, non-steroidal anti-inflammatory drugs. What is the best strategy to minimize the risk of gastrointestinal complications? A. Take NSAIDs with food. B. Use a lower dose. C. Co-prescribe a proton pump inhibitor. D. Alternate NSAID. The right answer will be C. Co-prescribe a proton pump inhibitor, which should help protect the gastrointestinal lining and reduce the risk of ulcer formation when NSAIDs are necessary. Next, a pharmacist is counseling a patient on the use of oral contraceptives. Which of the following should be discussed regarding missed doses? A. If one dose is missed, take two the next day. B. Missing a dose has no impact on efficacy. C. If two doses are missed, additional contraception is needed for 7 days. D. Missed doses should always be reported to the doctor. The right answer will be C. If two doses are missed, additional contraception is needed for 7 days. Next, which of the following is a potential side effect of long-term corticosteroid use? A. Weight loss. B. Hyperglycemia. C. Increased lipid. D. Hair loss. The right answer will be B. Hyperglycemia. Long-term corticosteroid can use lead to elevated blood sugar levels and may precipitate diabetes mellitus and predisposed individuals. Next, a patient with asthma is prescribed as short-acting beta agonist SABA. Which of the following medications is classified as a SABA? A. Salmeterol, B. Formoterol, C. Albuterol, D. Budesonide. The right answer will be C, which is a short-acting beta agonist used for quick relief of asthma symptoms by causing bronchodilation. Next, a 50-year-old male with diabetes and hypertension is being treated with metformin and lisinopril. Which of the following monitoring parameters is most important for metformin therapy? A. Serum electrolytes, B. Serum creatinine, C. Liver enzymes, D. Blood pressure. The right answer will be B. Serum creatinine. Metformin can cause lactic acidosis, especially in patients with renal impairment. So, monitoring serum creatinine is essential to ensure safety. Next, a patient receiving chemotherapy develops nausea and vomiting. Which of the following classes of medications is most effective for this condition? A. Antihistamine, B. Serotonin receptor antagonist, C. Opioids, D. Proton pump inhibitor. The right answer will be B. Serotonin receptor antagonists, such as ondansetron, are highly effective in preventing chemotherapy-induced nausea and vomiting. Next, which of the following medications is a potential cause of drug-induced lupus erythematosus? A. Procainamide, B. Metoprolol, C. Aspirin, D. Simvastatin. The right answer will be A. Procainamide, which is known to cause drug-induced lupus erythematosus, is susceptible individual, which leading to symptoms resembling systemic lupus erythematosus. Thank you so much for watching. Please don't forget to subscribe, like, and share. And wait for us next time to answer some questions of Prometric for Pharmacists. See you soon. Bye.